Hey everybody, it's Dr. Randy, Kalkstein Family Chiropractic. Wanted to shoot a video today and talk about our x-ray, our digital x-ray machine, and go over one of the most important films we'll take for new patients, and kind of give you an example of what we're looking for. So first of all, our x-ray machine is digital. So it's a really cool feature. As we take a new film on somebody, and we do this for new patients or patients who haven't been in a while, we'll take a film and then it actually goes right to this computer in seconds. So as you come in to see me as a new patient, whether it be for neck pain, back pain, shoulder pain, hip, headaches, if it's clinically necessary so that we can find out if there's no underlying conditions, or just to get a picture into your spine to help me adjust you better so you get better results quicker, x-rays are really helpful. We take the film, goes right to a computer screen. Like I said, it takes seconds, and then I can go over them with you one-on-one. And that's a really important feature that we do at this office, and same with our Monroeville and our North Huntington offices, is the doctor's gonna sit down with you and go over your x-rays, compare them to a set of normals so you can kind of see where you're at. And we can get an idea of the wear and tear that your spine's been under, where you're misaligned, where there's scar tissue buildup. And by knowing those things, we can get you have more effective care. So today I want to go over the lateral cervical x-ray, which is a really important film. One of the reasons is we're all on our phones now all the time. We work at a desk, we travel, we're all doing things. Kids as students have their head down in a book, reading, writing, their shoulders become rounded, and we're in this position with our head forward all the time. So if we look over here, what the neck should look like from the side is this cervical curve. I don't know if you can see this right here, but these are the old films we used to use, but this was our normal that we used to compare people to. Here's the back of this person's skull, here's their jawline, here's this cervical curve right here. See the nice smooth 45-degree angle? This is what it would look like on a plastic model. Nice smooth 45-degree angle. What we see now in the office with over 80% of our patients, young and old now, it's not age related, is we see this forward head carriage where the neck comes forward like that. That puts a lot of pressure on the intervertebral disc space. It also pulls and stretches your spinal cord and the spinal nerves that exit there. Not to mention what it does to the muscles, the posterior muscles of the neck. Puts a lot of tensions on the muscles of the neck. So instead of having a nice smooth arc, people are walking around with their neck like that. Now, because the neck's not a weight-bearing part of the body, you're not putting, like your low back and your hips, you're putting pressure every step you take on your hip and low back. You're more likely to feel a problem down there quicker. But with the neck, it's not weight-bearing. You're not going to really know that's there maybe necessarily until someone presses on it. Until you come in to see us to get an exam, and we check your neck, and we'll feel those areas where your neck's out of alignment, where there's scar tissue buildup, most likely because your neck's, on x-ray, your neck is really shifted forward. So again, that's the normal, and people are forward all the time, putting a lot of stress on the disc, the nerve, the muscles. So that's a big x-ray that we want to take in the office. Here's an example on the digital system. Again, another nice feature with this system is I have all these tools where I can show you right away where your neck is in relation to the normal. So if you see this person here, again, here's the back of their skull, here's their jawline. This person's looking straight this way, and here comes the x-ray. The red lines are the backs of their vertebral bodies, the 7 vertebrae of the neck plus T1, but this green arc is where they should be. So we can clearly see this person's really shifted forward compared to the normal. Go figure, this person came in with headaches, neck pain, daily headaches actually, that have been going on for years, upper back, shoulder, neck pain. And so we took a film, we can clearly see why. Now, I don't need to fix this person's x-rays to get them out of pain. The pain's gonna go away much sooner in a visit or 2 or 3 or 4, depending on how the person tolerates the adjustment. But the x-ray can give us, at least we have the understanding now of the underlying causes of this problem. So we're not just taking Tylenol and Advil and pain meds and muscle relaxers. We want to get to the root cause of it, which ultimately is the alignment of these vertebrae. So this gives us a clear picture into the spine, and we're going to get this person better as quickly as possible. So again, if you're having any problems, headache, especially, this film we focused on this curve of the neck, so it's really important. If it's something you're interested in, headaches, neck pain, stuff like that's been bothering you, we strongly encourage you to come in. We have x-ray at all 3 offices, our North Huntington, Monroeville office, and here at Irwin. And we can take a film if it's clinically necessary, and we can help you feel better. So again, thanks for watching, and we'll see you next time. Bye.